Hello, a very good evening to all of you. Today we are going to see the case note of George Gale. Mr. George Gale is an elderly patient who was in your care after a fall at his home. Today's date is 15 May 2021 and he is about to discharge on this particular date, and this is your preliminary information on top of the case note. Now I am moving to the task which I have to write. It's here. I can look at the task. Using the information given in the case notes, write a letter of discharge to Miss Gold, the head nurse at Primrose Nursing Home. So you are going to write a discharge letter to Miss Gold, and her full name is Jane Gold, head nurse, Primrose Nursing Home, 3 Blackwood Street, Old Town. So this letter is a discharge letter, and you are writing to a head nurse, and her name is Jane Gold. Now, what I have to include in this letter, it should briefly include Gale's history. History in the sense, the social history, the past medical history, and the present medical history. So you don't need to go in detail. So look at the word very clearly, briefly outline. So I don't need a detailed explanation here. I just need to concise the data. See, for example, I am going to say about Mr. Gale's had a fall. So how he fell, where he fell, who were there, how he was brought to hospital. So we have a lot of data there in the case note. We don't need to give all these things. We need to briefly outline what happened to Gale at the time of admission. Okay, what were the observations you have made, and what did he verbalize about his condition? What investigations you have done, or what examinations you have done, and what treatment you have given? What is his present condition? So just go ahead with a brief outline of Mr. Gale's history. I told history includes social history, past medical history, present medical history, as well as your concerns and recommendations. Do you have any concerns? Yes, I do have some concerns here in this letter. And I do have some recommendations to the addressee, that's the head nurse, that's Jane Gold. So we have, as we have understood the task, let's go ahead and see what the clear picture of this patient is. It's Mr. George Gale. He's 85-year-old. Now he is living alone. He socializes well and lives an independent life. And these 3 things I have selected from the social background. I selected the name, I selected the age. I go with the date of birth instead, because we are in a different time frame. So I go with the date of birth, name. Okay, these 3 things. Then I went with hypertension. Then I went with this non-specific colitis. I skipped the osteoarthritis. because it was diagnosed long ago. It's around 20, almost 18, 20 years ago. And we don't have any complications which is related to osteoarthritis. It's a remote history and it has no relevance at present. And about this gastroesophageal reflux disease, and he has got it corrected with antacid tablets. I don't need to include that thing. So I don't need that. I just need the hypertension for which he is taking felodipine, and we have osteoarthritis. Okay, fine. I have to go with osteoarthritis too. Sorry, because he's taking, so I just missed it. Osteoarthritis, hypertension, and non-specific colitis. So he's taking medications for osteoarthritis, so it's important. He's taking medications for hypertension, so it's important, and the medications, it's a regular medication, so it's important. I'm very sorry. I just had a confusion there in this thing. So with the ears. Osteoarthritis definitely is important because he is taking regular medications for osteoarthritis. And I think it is more significant when he is getting aged. Now he's 85. So he's more prone to fall. When he falls, he may have some complications. So it's very important there. Now, the presenting complaint here is disorientation and fever. So disorientation and fever is the presenting complaint. So how he was presented with it. He presented to us in a condition. He was brought via an ambulance, and at the time of admission, presentation, he was not oriented, he was disoriented. He had fever. Now he fell on the 9th, and he was brought to the hospital on 10th. Now he reported that he had a fall again. He had a fall 2 weeks ago, and he had an episode of vomiting, palpitations, and dysuria. Now these are the complaints he mentioned about himself. Now on observation we had, we understood that he is disoriented, he has confusion, and he had his all the vitals out of range elevated. Now that is a high an amount of white blood cells when we conducted the urinalysis. So this confirmed the infection, the urinary tract infection. And this might be because of this might be the reason of the fall. Probably it's a chance. Now what we had as the treatment, we had regular medications, paracetamol and felodipine for hypertension and osteoporosis. Apart from that, we started IV antibiotics, that's amoxicillin. Now, slowly from 10 to 14, almost 5 days later, when we assessed, we have all his vital parameters brought back to normal with the help of antibiotics. The antibiotics is working effectively. Now, when he has got his condition stabilized, he is now ready for discharge. But he is not ready to get discharged to home because he's living alone and he doesn't have anyone to help there. He could have gone independently, and but because of this condition, because of the hospitalization, because of the fall, and related things, because of hospitalization, he became too weak, and he we have to see that he had significant lowered mobility. So he had significant lowered mobility. So for that, we have to encourage him physical activity, 30 minutes at least a day. Still episodes of confusion. Now, this is the current condition. He has confusion still. He has reduced his mobility significantly. This is what his present condition is. But he wishes to go home. He wants to return home as soon as possible, to live alone, to live independent, to live an independent life. He needs to go back. Now, write the head nurse, nursing home regarding further care required. The further care is these things. Let's go with the date. Today's date is 15 May 2821. Jane Gold, head nurse, Prime Rose Nursing Home, 3 Blackwood Street, Old Town. Dear Miss Gold, okay, I have a small comma here. Reference Mr. George GALE, date of birth 24 April 1936. Now we have the very interesting part of the letter. That's the purpose paragraph. Let's highlight it in blue. Yeah. Now we can read it. I'm writing to request temporary residential care for Mr. George GALE. So Mr. George GALE requires some temporary residential care. So he's moving back to his home once he's becoming all right. He needs a temporary arrangements for his settlement. I'm writing to request temporary residential care for Mr. George GALE, who has been under our care after a fall, which might have occurred due to urinary tract infection. So this might have occurred due to urinary tract infection. What might have occurred due to urinary tract infection? The fall. He fell, and the probable reason may be urinary tract infection. And that's what given in the question. You can see here as the diagnosis. Urinary tract infection, query, cause of fall is maybe it may be the reason for the fall. And that's what we have discussed in the purpose. Has been discharged to your facility today. So I need to say that today is going to discharge. He's going to be discharged. This is a discharge letter. So I need to inform the addressee that he is being discharged today. So the purpose is very much complete. It's simple, it's understandable. So why are you writing the letter? You're writing the letter to request care. And that too is temporary residential care. For whom? Mr. George GALE. Who is he? He has been under our care after a fall. Oh, what happened to him? Why he fell down? This might have occurred because he had a urinary tract infection. This might have this might have occurred because of UTI. Okay, when he's going to get discharged, when he's coming here, oh, he's coming today. Okay, so it's simple, and we have completed it in 2 sentences there. Now let's move ahead with the first particular paragraph. Let me go ahead with that. Okay, make it green. Yeah. Miss Gale was disoriented and febrile when he was brought to the hospital on 10th of this month, following a fall at his home a day before. A day ago. It is not before. Okay, so he was brought to the hospital. So disorientation. So he was disoriented, he was febrile. That's what we have said. He was brought on 10th May. 9th May, he fell down. So this is what we have discussed in the first particular line. Upon regaining his consciousness, he was disorientated. Upon regaining his consciousness, he reported that he had single episode of vomiting. So he had once he had vomiting, he had palpitation and dysuria. Now, this was the subjective data. When we go with our objective data, we can say on examination. So I can mark it as separate here. On examination, his vitals were marked above the normal range. So vitals, all the vitals were marked above the normal range, and the urine analysis revealed the signs of infection. So it revealed signs of infection. You know that you had an elevated WBC counts, pus cells, I think so. It was there, which was treated with intravenous amoxicillin. I'm not going ahead with the dosage and the route and the duration, because I'm briefly outlining these things. I'm not going to detail these things as well, as far as this is not asked to you. Now, although the therapy, the antibiotic therapy which you have initiated, although the therapy was effective, his mobility is now seen lowered significantly. Now, the antibiotic therapy was found good. He responded to it positively, but he has lost his mobility significantly. He's lowered his mobility significantly, and is often confused. Now we have on and off confusions. Episodes of confusions are still there. Yes, it is here. This is the present condition right now. Significantly lowered mobility, still episodes of confusion. But you can see that he has no dizziness, no palpitation, vitals became normal, all things came normal. However, he has a keen interest to return home and resume his normal life. So this is what patient keen to return home as soon as possible. Now about the social and the past medical history. The social history: he lives alone, he is socially active and prefers to be independent in his own activities. This is his character, this is his social history. He has hypertension and osteoarthritis for which he is on felodipine and paracetamol regularly. So he is on regular medications, felodipine, paracetamol. He was diagnosed with a non-specific colitis and is on ongoing monitoring. Now he was also, I had hypertension. He has osteoarthritis. I think so. Yeah. Medications are there. And he does have one more problem, that's non-specific colitis. And though it's not a problem and he's not taking medications right now, it needs to be monitored closely and is on ongoing monitoring. Kindly accept Mr. Gale to your facility and assist him in activities of daily living. Okay. till you feel he is capable of leading an independent life at his home. One more thing I just need to add is about the exercises, which we have 30 minutes day per day of physical activity to be encouraged. Okay, please note he needs encouragement to walk at least 30 minutes a day. Okay, to improve his mobility. Okay, so this is what we have added here. So in order to increase his mobility, we need to encourage at least 30 minutes walk, and that's what we have written. Physical activity, 30 minutes. I go with exercise, that is better than the other thing. So now we have completed. I have my closing sentence pending here. If you have any further queries regarding Mr. Gales, please do not hesitate to contact me. Okay, if you have any further queries regarding Mr. Gales, please do not hesitate to contact me. Yours sincerely, nurse, Old Town Hospital. Now the complete letter is there. This is an acceptable format. Okay, you can have other formats too. This is just a basic. This we have got a basic letter with a good organizing things. We have selected the relevant data and we have presented it very briefly, and all our tasks have been accomplished. That is the history, the concern, and recommendations. Thank you, and that is the end of this session.